Hi, today's health question is, what can you do to reduce your risk of stroke? I know we've talked about this a little, Josh, but maybe you could summarize. There's a lot we can do to reduce our risk of stroke, isn't there?
Absolutely. I think there's several lifestyle modifications you can do to reduce your risk of stroke. And the biggest one is if you smoke, stop smoking. I think smoking is one of the number one cause of stroke, whether it's ischemic stroke or hemorrhage or aneurysm formation. Smoking is a big risk factor. So stopping smoking is going to be number one. Control of blood pressure, control of cholesterol. These are two other big lifestyle modifications. So appropriate medication for blood pressure and consistent blood pressure lowering. These are all big lifestyle changes that I think reduce
And then,
your risk.
exercise and healthy diet and all the things that we talk about all the time.
Absolutely, all healthy lifestyle.
Anything in family history of aneurysms, is there something there that people should be aware of?
There is a family history of aneurysms in up to 10% of patients. We don't really worry about it. If you've had a first-degree relative who has an aneurysm or who's had a hemorrhage, that doesn't mean you need to go run and be screened. If you've had two family members with aneurysm, at that point we start advocating for some screening.
So that's helpful. So you should be aware of your family history, which is true for across all diseases, but two first-degree relatives who have had an aneurysm, be aware of it and maybe get screened for it.
Absolutely.
And get your aneurysm closed before it bleeds.
Exactly.
Well, this has been extraordinarily helpful. Welcome to the area.
Thank you.
And I thank you myself, but for all the people out there that are going to be saved by your intervention or helped by your intervention, that's just fabulous. We're really glad to have you, Josh.
Thank you very much. I appreciate it.
And so if you at home have a question you'd like to ask me on Health Talk or ask our guests, please contact us at healthtalk@oralhealth.org.